not going to make this one. Investments.
So if you're joining us by web conference or on the live stream, we're going to get started in about 5 minutes. Just a reminder, the microphones in the room are on, and those that are joining by web conference, the microphones are on if you unmute yourself. We'll get started in a couple minutes.
That's your new intern? You're the intern?
Unpaid.
Thank you. I like volunteers.
Here you go, Sam.
Oh, wait, what? You didn't even hear me.
I didn't.
See, I like volunteers.
Got it.
Thank you. I like volunteers.
No, I didn't get one yet. Your intern's a little slow. Can't talk to him.
I went to your office, it was closed, so.
For the office? Hey, he can't somebody over there talking. You're done. You're done. Not working here.
They went and dragged the hats out, put them up.
What is this now? We're getting everything ready for several minutes. Great. Like you see, it's decided to repeat itself in the middle of all this. Great. What's timing?
Oh, no, he didn't get it. I got it.
Let's see, hang on. Where are we at?
Only I can read.
Yeah.
Got a big thing going on a useful driver.
In just a second. Don't.
Paper agenda.
Started working, I got it printed. We sent 2 amendments, and then another.
Okay, good morning, everyone. The hour of 9:45 having arrived, I'd like to call the Kane County Board meeting of July 14th, 2020 to order. Okay. In the while that's warming up, how about if we take the roll?
Allen,
Allen, present.
right? Barrero,
Guerrero here.
Davis. Davis. Pratt.
Here.
Hanson. Hernandez.
Here.
Hoshite.
Here.
Iqbal here.
Kenyon.
Here.
Caius.
Caius present.
Kopi.
Opie's here.
Leonard.
Here.
Lewis. Martin.
Here.
Molina.
Molina present.
Sanchez.
Here.
Shefflo.
Here.
Silva.
Silva here.
Garrett.
Starrett, present.
And Surgis.
Here.
Thomas. Thomas. Weber.
Here.
Wegman. Winnicky. Here.
Okay, we have a quorum. Thank you very much for coming today. Let's see, I'd like to ask Chris Allen, our new Director of Capital Projects, to come to the microphone and lead us in the pledge. Chris Allen comes to us with many years of military service and more than 25 years of experience in facility management and capital project construction management. And Chris brings an impressive work history that building management will use to the benefit of Kane County. Chris, good to see you this morning.
Is this on? Yeah.
It is.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. And if you'd remain standing, I'd like to introduce Father Jack Reichart. He was ordained just a month ago. Father, if you'd come forward. He is an associate at St. Patrick's Catholic Church in St. Charles and is going to lead us in prayer. So welcome, Father, and congratulations.
Thank you. Let's pray. We ask, Lord, your blessings upon the people who have been called to lead this community. Grant them and us the wisdom and courage to know what to do and right and wrong. Remind them that they are not only leaders, but also servants, and that is their responsibility and ours to serve the common good of all. Almighty everlasting God, in whose hand are the powers of all rights of all peoples, look favorably on those who rule over us in power, that with your right hand protecting us, integrity of religion and security of country may unceasingly abide throughout the world. Through Christ our Lord. Amen.
Amen. Thank you, Father. Motion and a second to approve the minutes from the June 9th and the July 2nd, 2020 meetings. So moved by Mr. Kenyon, second by Mr. Surgis. Are there any adjustments, comments, thoughts?
Just Davis present.
Thank you.
Okay, seeing none, Mr. Davis will be added to the roll.
Thank you.
Seeing none in those present, any thoughts or comments, changes to the minutes from those on the phone? Hearing none, clerk call the roll.
Allen.
Allen,
Barrero.
Guerrero, yes.
Davis.
Davis, yes.
Raz.
Yes.
Hanson. Hernandez.
Yes.
Hernandez, minutes. Boschheit,
Yes.
Iqbal,
Yes.
Kenyon,
Yes.
Caius,
Yes.
Opie.
Abstain.
All right. Leonard,
Yes.
Lewis,
Yes.
Martin,
Yes.
Molina,
Molina, yes.
Sanchez,
Yes.
Shefflo,
Yes.
Silva, did you arrive?
Silva has been here and Silva, yes.
Okay, thanks. Starrett,
Starrett, yes.
Burgess,
Yes.
Thomas, are you here?
Yes.
Okay,
Yes.
thank you. Weber,
Yes.
Wegman? Yes. Winnicki?
Yes.
That passes.
Okay, so those two sets of minutes are approved. Public comment, action to place public comments on file, agenda and non-agenda items. Are there any public comments? Seeing none in the audience, are there any on the phone?
None.
Hearing none, we'll go on to presentations. This is one of my favorite events each year where we celebrate 20 years of service for our employees. There are some stalwarts in the audience today, and I'm going to turn it over to Sylvia Wetzel to make the recognitions.
Good morning, everyone. It is my honor to join the County Board Chairman and the Kane County Board in recognizing our 20-year anniversary employees. I know that you join me in congratulating each and every one of them. So before we proceed, if we could move to the next slide and show their names. If you could join me in a hand of happy applause in recognizing these 37 employees today. There goes. In keeping safe, we will call groups by departments. When you hear your name, if you are here today to be recognized, please come to the front to receive your recognition from Chairman Lawson and proceed to receiving your Kane County Service Award packet, which has a delicious cookie with the Kane County logo that was made from Graham's. Please keep 6 feet apart before proceeding up to the front. Thank you.
Let me just say ahead of time that one of the reasons why I got into public service was I do like shaking hands and kissing babies. And so not to be able to shake hands with people who have distinguished themselves with 20 years of service, it's very hard. So I'm there, I'd give you a big hug, but you know, we're going to follow those safety guidelines.
Carol Veratoni, Animal Control, if you're in the room, if you could proceed to the front. Carol Veratoni, if you are in the room from Animal Control, if you could proceed to the front. Yes, please.
Oh, okay.
That speaker right behind. So
Thank you very much for your service.
Barbara Bagalka, Circuit Clerk, if you are in the room, if you could proceed to the front. Congratulations. James Caparelli, Circuit Clerk, if you are in the room, if you could proceed to the front. Janet Davis, Circuit Clerk. Juan Cifuentes, if you are in the room, Circuit Clerk. Juan Cifuentes. Raymond Escovel, Circuit Clerk. Congratulations. Heidi Jacobitis, County Clerk. Nicole Bull, Court Services. Nicole Bull.
Hey. Okay, how are you?
Heidi. Sarah Keefe, Court Services.
No, I'll be back on Monday.
Jennifer
I'm
Kohlberg,
still waiting for my
Court
result.
Services. Jennifer Colwelter, Court Services. Megan Rolder, Court Services. Michael Roman, Court Services. Karen Miller, Development.
Oh, okay. Oh, geez. Okay.
Timothy Kavanzak, Finance. Nora Arch,
Right. No, I
Health
agree with
Department.
that. That's fine. We can send over whatever we need. Okay.
Michael Isaacson, Health Department.
Okay.
Jason Veritert,
So-
Information
so is
Technologies.
Is Kathy over there now?
Andrea O'Brien, Judiciary and Courts.
Yeah.
Congrats.
No.
Brenda Covey, Public Defender.
Kathy, just Kathy.
Sandy
Kirkton,
Wegman,
Is she,
Recorder.
is she helping at the JC or is she here at 3rd Street?
Luis
Okay, she
Aguirre,
is. Okay.
Sheriff Adult Corrections. Susan Lampert, Sheriff
Got it.
Adult Corrections. Mary London, Sheriff Adult Corrections. Stephen Montalvan, Sheriff Adult Corrections.
You,
James Naley,
Monica?
Sheriff Adult Corrections. Hugh O'Connor, Sheriff Adult Corrections. Lloyd Fletcher, Sheriff Court
Okay.
Security.
Well, yeah, I mean,
No, nobody. Deborah
are you
Bree,
going over?
State's Attorney. Frank Bumpus, State's Attorney. Adam Katz, State's Attorney. Michael Corwin, State's Attorney. Joe Lovis, State's Attorney. Mark Stadodar, State's Attorney. Joseph Cullens, Transportation. Corey Hauser, Transportation. Congratulations. Congratulations.
Thanks.
That concludes our recognition of these very valued, dedicated employees.
Sheriff Nick Wolf.
Oh, Sheriff Nicholas Wolf. Forgive me.
Thank you. Congratulations. In their corner.
How could we miss you? Congratulations. If you could please join me in a warm applause recognizing these wonderful employees. Thank you, ladies, for your help. Couldn't do it without you.
Thank you, Sylvia. Appreciate your help. Okay, next is recognition of court services, community engagement. I'm going to ask Lisa Ost to come on up and recognize the efforts of some folks in court services. Thank you, Lisa.
I just wanted to take a moment to recognize actually a couple of my employees who are here. LaTanya Hill, who's a director of probation. And next to her is Jennifer Peacock, who is a probation officer out of the Aurora office. It was Jennifer's idea to try to give back to the community. As government employees, we work really hard for the community. And right away, she noted, I mean, we're so lucky and so fortunate to be supported by this amazing community. And she wanted to try to find a way to give back to all the people who are unemployed. And so she personally led this food drive and reached out to all of our justice partners to try to make sure that we're giving back to the community, even as we continue to be employed. And I'm very grateful for those kind of values that our employees have.
Okay, thank you very much, Lisa. Next, we have a presentation by Sheriff Kane. And this is on the body and in-car cameras. So is the sheriff with us at this point? Okay, let's see if we'll go ahead and go to the next presentation and come back to the sheriff if he arrives. The next presentation is King County 211, Lisa Feudel and Melinda Kintz. So welcome, ladies, and thank you very much for good work on a good program.
Thank you. Thank you for having us. I know most of you are somewhat familiar with 211, so I'm not going to dive into all of those very basics because we want to give you updates. Okay, so what is 211? It's just like 911. We want people to think of it that way. So it's a core infrastructure. You would dial 911 for emergencies and 211 for human and social services. Before 211, people who were in need might reach out, but they might reach out to the wrong location and not get the information that they needed, not get the referrals. But when we have 211 in place, people can dial 211 regardless of what the need is and get the referral to the appropriate department, social service organization, non-for-profit, whatever it is. So I'm going to go through these next slides rather quickly. 211 helps people with basic needs, so food, shelter, electricity, rent payments, all of these are usually the very top priorities, but also physical and mental health resources. There are numerous drug and alcohol rehab programs, employment with vocational programs, training, GED, support for seniors and people with disabilities, and then also support for children and families with child support, tutoring, after-school programs. This is the call volume from 2020. So you can see January and February, we're in a normal call volume, but look at March. Our call volume in March was up over 400%, I think. And it's evened out a little bit, but the call volume is still very, very high. These are the numbers from the first quarter, and this is distribution by need. And you can see that housing expenses are right up at the very top. And then calls pertaining to COVID-19. Sometimes these were calls to get information, but also just because people were feeling uncomfortable and needed somebody to talk to. By zip code, this has pretty much remained the same over time, with Aurora being the #1 zip code for calls, followed by Elgin and then St. Charles. But throughout the county, there are calls from every zip code in the county to 211. Now, this is some updated information with second quarter. It's a little hard to see, but I wanted you to get a feeling for all of the types of details and reasons that people call. Rent assistance is right up there at the top. Homelessness and need for shelters and services is #2. In COVID-19 related calls is #4 on the list. So 211 has been a huge support for people during this time. Again, this is a little difficult to see, but you see up at the top The Catholic Charities are the #1 referral. And that's out of Rockford, but that's because that's where the diocese is. Community Crisis Center up in Elgin is always very high. They had 126 referrals, I think that says, but next to it, the number 71 is strictly because of COVID. The number of calls they've gotten due to COVID-related issues was 71. So they've broken it down 2 different ways here. And then at the bottom of the page, the top unmet needs, homeless shelters are up there. The shelters in Kane County are full right now, and there's a lot of people who are living on the street, and that's going to continue to grow. Oh, so I added one slide yesterday at the end of the day, and it's unfortunate that it's not here because it shows that over 30 governors throughout the United States are requesting any COVID-related calls to go to 211. So they're making this known statewide that 211 can handle all of the COVID-related calls. And again, throughout the United States, as we get back to what we would consider a potential normal and have the, yeah, here it is. As the courts open and people are able to get evicted, that's going to become an even bigger problem because so many people have been unable to pay their rent these last few months. But landlords are going to be coming for them, and that's going to become a big issue. Up at the very top, you see two lines on the graph. The bottom is the call volume during regular non-COVID times, and the top line on that chart is the calls during COVID. So calls are way up. Top needs, housing, food, and COVID-19. So if anybody has any questions, I'd be happy to answer them, but I wanted to give you that update today.
Okay, thank you very much.
Okay, thank you.
Yes, of course.
I just wanted to say, we're just entering our 3rd year starting August 1st, and we are so eternally grateful that the county continues to split the primary cost of this program with the school districts. So just want you to know that we are working behind the scenes, applying for various grants to try to ease that load, to keep up the marketing. Obviously, this program is only good if people know about it. And we've been told by our call center that it takes about 5 years to get your 211 really at the level that it should be. And we're closing in on that, but we can't do it without the funding that you provide. And we just want to let you know how grateful we are for that. You're really helping a lot of people. And anytime anyone would like access to the data that we receive and helping you plan for the future. So for example, one thing that we keep hearing is that the homeless shelters would really, really love to have a supply of motel or hotel vouchers to use at their discretion. These are things that we're able to pull out of the data that we're getting from 211, and we can call 211 and ask them, tell us a story, tell us what's going on, give us a few examples of what you're doing for people. So if anyone ever needs any information like that, please just reach out to me at the Batavia United Way, and we'll make sure you have what you need to help make solid decisions. Thank you.
Thank you very much.
Thank you.
Okay, next item on the agenda, we'll go to Sheriff Haynes' presentation on body and in-car cameras. Sheriff Haynes? Thanks for coming this morning.
This will just be a verbal. Thank you. Morning, everybody. Sorry I missed you at the first go around, trying to juggle a bunch of different things this morning. So this is a project that we began working on back in February to get proper quotes and assessment of a dash cam and body camera system for all of our deputies. Currently, our program is very outdated. We only have dash cams, and it's mixed technology. So we have some antiquated equipment that does not provide for HD video, which of course presents a problem for our state's attorneys when they're arguing for us in court. And of course, for professional standards purposes, when we are reviewing deputies' courses of action. So this acquisition here is a lease for 5 years. It will empower all 65 of our deputies and sergeants to have both dash cam system and body cam systems. It'll have dash cam and body cam systems on a combined platform. So there is an amendment to the resolution that we put up through the Digital Public Safety. So we just got a updated quote this morning from GTAC, which is the, from Midwest, the distributor that won the RFP that we put through purchasing. The only bidder was Midwest. And it is for the GTAC camera system, which is one of the top 3 best camera systems in the United States, if not top 2. So the updated lease amount per year is $141,799.46. This reflects updated financing and some ancillary equipment, cables, brackets to install them in our squad car. So the total lease over 5 years is $650,508.65. The first year will be paid out of overage in our budget. So we have the funds currently in our general fund budget to cover that in 2020. And we've asked for it in our budget going forward, 2021 and beyond. Any questions?
Okay, Mr. Leonard.
Thank you, Mr. Chairman. I just wanted to thank Mr. Hanson for suggesting that Sheriff Kane come and explain to the full board. At the Judicial and Public Safety meeting, of which Mr. Hanson's a member, we all agreed it's obviously a necessary procurement that we have to take. And I think it was important that Mr. Hanson asked that Sheriff Kane come and present it to the whole board. This is something that will help us in many ways. In fact, yesterday, and I forget which city it was, a rather large city, there was an altercation where an individual was killed, and there was the start of protest, and the police commissioner came on and showed the body camera work from it, proving that it was a justifiable reaction after being shot at. The police had been shot at twice. So once again, I think this is very necessary. It protects not only our deputies and our law enforcement people, but also the public. So I'm in full support of it, and I thank Sheriff Kane for coming and presenting, and for Mr. Hanson requesting that.
Thank you, Mr. Leonard. Any other comments? It's normally during presentations, we just give the presentation and we save the discussion for at the standing committees. But thank you very much for coming, because it's very important. Thank you, Sheriff. Okay, next on the agenda, zoning petitions. Turn it over to Mr. Martin to rise, discuss, and take us through the appropriate procedures to approve the zoning petitions on today's agenda.
We have one matter before us today, which is petition number 4546 in Plato Township. The petitioner is Lynn Landmeyer and others. The property involved is commonly known as 42 West 665 Plato Road, again in Plato Township. The action sought is the rezoning of the property from F District Farming to F1 District Rural Residential. There was no Regional Plan Commission jurisdiction. The zoning board approved with some exceptions which were adopted by the Development Committee in its approval. I move the approval of this and request a second. Mr. Kenyon seconds. Any comments or questions? Hearing none, would the clerk please call the roll?
Ellen?
Ellen, aye.
Ferrero?
Ferrero, yes.
Davis?
Davis, yes.
Raz?
Yes.
Hanson?
Yes.
Yes. Oshite?
Yes.
Iqbal?
Yes.
Kenyon?
Yes.
Caius?
Caius, yes.
Hopi?
Hope yes.
Leonard?
Yes.
Lewis?
Yes.
Martin?
Yes.
Molina?
Molina, yes.
Sanchez?
Yes.
Shefflo?
Yes.
Silva, yes.
Starrett?
Starrett, yes.
Burgess?
Yes.
Thomas?
Yes.
Weber?
Yes.
Wegman? Yes. Winnicki? Yes. That passes.
Motion carries. Petitions approved. Thank you.
Okay, thank you. Resolutions, ordinances, consent agenda. Would anyone like to remove an item from the consent agenda?
Mr. Chairman,
Yes.
this is Chris Caius, District 23. Can you hear me?
You can.
Please remove item 231 and 237.
31 and 237. Others
please.
that you would like to remove from the consent agenda?
Mr. Chairman,
Yes, would you identify yourself, please?
this is Deborah Allen.
Oh,
and
Miss
I'm-
Allen.
Thank you, and good morning. And I'm asking to remove 218.
Okay. Others? Seeing none in the folks present, any others from folks on the phone? Hearing none, may I have a motion and a second to approve the consent agenda with the exceptions of 2218, 231, and 237? So moved by Mr. Sanchez, second by Mr. Leonard. Clerk, call the roll.
I'm sorry, Alan, for the consent
Allen,
agenda?
aye.
Okay. Ferrero,
Ferrero, yes.
Davis,
Davis, yes.
Raz,
Yes.
Hanson,
Yes.
Hernandez,
Yes.
Oshite,
Yes.
Iqbal,
Yes.
Kenyon,
Yes.
Caius,
Caius, yes.
Opie,
Yes.
Leonard,
Yes.
Lewis,
Yes.
Martin,
Yes.
Molina,
Molina, yes.
Sanchez,
Yes.
Shefflo,
Yes.
Silva,
Silva, yes.
Starrett,
Starrett, yes.
Sturgis,
Yes.
Thomas,
Yes.
Weber,
Yes.
Wegman, Winnicke.
Okay, the motion passes. So may I have a motion and a second to discuss and potentially pass number 2218?
Allen moves.
Sorry, was that Miss Allen?
It was, and I'd
Okay,
like to
thank
move
you.
the motion.
Okay, so Miss Allen moves, second by Mr. Sanchez. Miss Allen.
Thanks so much, Mr. Chairman. This project is uncommon in that we seldom build, and we have many partners who made this all come together. I just wanted to send out a special thank you here. We needed to move from the public market to the private market, and I believe that the paperwork in order to do that was more than most of us would ever want to deal with. So I want to thank Joe Onzik and his department for putting that together for us. Our other partners, the treasurer, the state's attorney, the committee, the board for wanting to go forward with this, the people who are going to enjoy the building, and the public that we want to serve. So just a shout out to Mr. Onzik for many hours and volumes of material to make this come together. Thanks so much.
Okay, is there any other discussion? Seeing none, any participants on the phone? Hearing none, clerk, call the roll.
Allen,
Allen, aye.
Ferrero,
Ferrero, yes.
Davis,
Davis, yes.
Raz,
Yes.
Hanson,
Yes.
Hernandez,
Yes.
Oshite,
Yes.
Iqbal,
Yes.
Kenyon,
Yes.
Caius,
Caius, yes.
Opie,
Hope yes.
Leonard,
Yes.
Lewis,
Yes.
Martin,
Yes.
Molina,
Molina, yes.
Sanchez, Shefflo,
Yes.
Silva,
Yes.
Starrett,
Starrett, yes.
Sturgis,
Yes.
Thomas,
Yes.
Weber,
Yes.
Wegman, Winnicke. Yes. This is
Okay, motion passes. Okay, may I have a motion and a second to discuss and potentially approve number 2231? So moved by Mr. Fraz, second by Mr. Iqbal. Mr. Caius.
Thank you, Mr. Chairman. On behalf of the residents in District 23 who oppose the scope and the toll on the Long Meadow Parkway project, I will be voting no on this, and I encourage other board members to do so as well. Thank you.
Okay, other discussion? Mr. Fraz?
Yeah, I'd just like to mention that this particular item approves for an additional $2.5 million in federal funding for the project, which of course reduces our expenses, which of course could ultimately reduce the toll, which I know has been one of Mr. Caius's goals also. So I'm getting mixed signals here, but I do recommend approval of this item.
Okay, any other discussion? Seeing none, in person, any other from participants on the phone? Hearing none, clerk call the roll.
Ellen,
Allen, aye.
Ferrero,
Ferrero, yes.
Davis,
Davis, yes.
Raz,
Yes.
Hanson,
Yes.
Hernandez.
Yes.
Can you turn up or speak louder into your mic for future votes? Hoshite,
Yes.
Iqbal,
Yes.
Kenyon. Yes. Caius,
You almost convinced me, Drew, but not quite. Caius, no.
Copey,
Yes.
Leonard,
Yes.
Lewis,
Yes.
Martin,
Yes.
Molina,
Molina, yes.
Sanchez,
No.
Dufflo,
Yes.
Silva,
Yes.
Starrett,
Starrett, yes.
Burgess, Thomas,
Yes.
Weber,
Yes.
Wegman. No. Yes. Passes with 3 noes.
Okay, the motion passes. May I have a motion and a second to discuss and potentially pass resolution number 2237? So moved by Mr. Fraz, second by Dr. Iqbal. Mr. Caius.
Thank you, Mr. Chairman. Once again, I'd like to speak on behalf of the residents in District 23 in opposition to the project and the toll on this, just because this will be the only toll on a non-major roadway in the state of Illinois. I'm going to vote no, and I encourage others to do so as well. Thank you.
Okay, any other discussion? Seeing none, hearing none, clerk call the roll.
Ellen,
Allen, aye.
Ferrero,
Ferrero, yes.
Davis,
Davis, yes.
Raz,
Yes.
Hanson,
Yes.
Hernandez.
Yes.
Thank you. Hoshite,
Yes.
Iqbal,
Yes.
Kenyon. Yes. Caius,
Caius, no.
Opie,
Opie, yes.
Leonard, Lewis,
Yes.
Martin,
Yes.
Molina,
Molina, yes.
Sanchez,
No.
Dufflo,
Yes.
Silva, yes.
Starrett,
Starrett, yes.
Surgis,
Yes.
Thomas,
Yes.
Weber,
Yes.
Wegman. No. Winnicke.
Yes.
That's with 3 nays.
Okay, motion passes. Okay, next on the agenda, under non-consent, may I have a motion to discuss and potentially pass resolution number 2213? So moved by Ms. Wonicky, second by Ms. Lewis. Discussion?
Mr. Chairman, this is Ms. Thomas.
Ms. Lewis.
So, I've been a proponent for this all along. And most recently, I have been talking to a lot of the school districts because we are getting ready to send our kids back to school. And a lot I've been hearing is the schools are prepared. They have PPE for the students. They have temperature checks when the students are walking in. They have lots of hand sanitizer. But what they are worried about is what's going on in the families, what's going to happen before the children get to school, and what's going to happen when the kids go home with grandma and the other people. And especially on the side of Aurora that I live in, we've got a lot of large households and a lot of families that are the students going to school and the grandparents and parents at home. And part of it is also this education. I know we think that everybody has now heard ad nauseum about hand washing and sanitation and all this, but we have a lot of families that really, really need to get this education in front of them, and also need to get things like the hand soap and those kind of things in front of them. I know that the 92 million, you guys have done a fantastic job trying to allocate and move that around, but this is preventative, and we do not want to go back like Florida or California, where we start to open up things and then go back. So especially the education piece that needs to happen and some of this money spent on that. I can't say enough about getting these funds out there. So thank you.
Okay, thank you, Ms. Lewis. Any other discussion? Seeing none in the room. Anyone from those participating by phone?
Yes, this is Ms. Thomas. I have a.
Okay, Ms. Thomas, would you increase your volume, please, if it's possible? And Ms. Thomas, you have the floor.
Yeah. Is that better?
Yes, that is better. Thank you.
Okay. I don't disagree with this resolution, but I don't know that now is the time to approve $1 million for PPE. Just further down on the agenda, we're voting on a resolution to provide funding to the health department, which includes 1.1 million for PPE. And just yesterday at the CAC meeting, we received information that listed $36 million potentially just for salary. And so I'm concerned about not seeing the full picture of current expenses and future expenditures. And so for that reason, because we don't have full information to consider, I will be voting no to postpone and simply postpone voting on this for now.
Okay, thank you, Ms. Thomas. Other discussion? Mr. Sanchez.
Thank you, Mr. Chairman. Yesterday, Mr. Onsick sent out a letter after he gave us the projected numbers and the total cost of expenditures for COVID-related expenses. And it shows a big number for public health, but he followed up and said that that does include the resolution that is on today's agenda. Just assuming that it would pass, he put it into that $36 million. So that's not 36 plus another 13. So I don't have much else to say about this resolution. I'm in support of whatever we need to do for public health, but I just wanted to make that clarification.
Okay, thank you, Mr. Sanchez. Any other discussion? Mr. Hanson.
Thank you.
Please rise.
Thank you. I think there's sentiment within our group to do whatever it takes to get the help and the education needed to respond to COVID-19 to all the residents of the county. I have a problem with this resolution because I don't know what we're getting for $1 million. I don't know who's going to be targeted in terms of who's going to be receiving it. And frankly, is $1 million enough? I just like to see more detail in a distribution program for whatever we're going to buy. And there's nothing in here saying what we're actually purchasing. Thank you.
Okay, thank you, Mr. Hanson. Other comments? Seeing none in the room, any on the participants from the phone? Hearing none, clerk call the roll.
Allen,
Allen, aye.
Barrero,
Barrero, no.
Davis,
Davis, no.
Raz,
No. Excuse me,
Hanson,
no.
No.
Hernandez,
No.
Hoshait,
No.
Iqbal,
Yes.
Kenyon,
No.
Caius,
Caius, yes.
Hopi,
Yes.
Leonard,
Yes.
Lewis,
Yes.
Martin,
No.
Molina,
Molina, no.
Sanchez,
Yes.
Shefflo,
Yes.
Silva,
No.
Starrett,
Starrett, no.
Burgess,
Yes.
Thomas,
No.
Weber,
No.
Hickman,
No.
Ann Winicky. 15 nays, fails. Nine 15. Fails 9.
The motion fails. Next on the agenda is number 20, 240. May I have a motion and a second to discuss and potentially pass number 2240? So moved by Mr. Sanchez, second by Mr. Leonard. Discussion. Mr. Hoshait.
Mr. Chairman, I'm not sure whether the resolution that was moved and seconded had a dollar amount in it. Is there a dollar amount in the resolution as presented? Was it 13 million?
12 million.
12 million, 12.9 million. All right. The next resolution that we'll be considering will seek to have board approval of the formal allocation of the COVID funds on a 55%, 45% basis between county uses and local government uses. And assuming that that passes, out of the 55%, the funds would be allocated to uses such as this. There were requests presented at the last executive committee meeting from the IT department, the sheriff's office, and the various other departments for requests for allocation of the county funds. The ordinance there, the resolution we just voted down, I don't think it was voted down because of no need for those PPP, that equipment, but it's to try to get all the requests in front of us so that we can come up with the appropriate allocation from a policy standpoint. The Mr. Ronzik's submissions together with the requests that were submitted at the executive committee will exceed the amount of the 55% that we have available. So we're going to have to make some decisions. Our committee tabled the requests from the other offices and departments so that we could consider them at a meeting in the very near future where we have all the requests in front of us. This resolution came through because of the urgency from a health department perspective and Ms. Jeffers' request for funds so she could proceed with contact tracing. I think her request for 12.9 million included roughly, if you broke it down, 5 or 6 million or so for the contact tracing component. And I think there was another $1 million or so in support that would be needed to move that program forward. And so if we move forward with the resolution as presented today, we're using up a portion of the county's allocation. If the board's committed or prepared to do that, knowing that we have other competing requests, I have no objection to doing that. You just should vote on this knowing that. One approach could be to table this and consider it with all the other requests. Another option would be reduce it to include contact tracing only, or the third is to simply approve all the requests, and from that standpoint, the health department would be taken care of.
Okay, Mr. Hoshait, would you want to clarify? I understand that those are the three options. Would you recommend or move any of those three?
I'm not seeking to amend the motion as presented. I'm just asking the board to recognize that the motion on the floor uses up $12.9 million, and I'll leave it up to the board to make the decision. Our committee is working openly with the entire board, and obviously everyone's input is welcome.
Okay, Mr. Sanchez.
Thank you, Mr. Chairman. I definitely agree with Mr. Hoshait that it's important for us to consider how the county is spending its money. This is something that is a little more urgent, and it is the reason for the season, so to speak. It's the main cause that we got CARES Act money for. It's public health response. I know Director Jeffers is here. I don't know if she is, we can ask her to speak on this at all. I would like to hear some of the justification, because we understand this is more than just contact tracing. That's one component of this, and the title says the overall response. So I didn't know if Director Jeffers could kind of explain and walk us through what's in this.
Okay, the full board is together now, and so recognizing that not all members have been at all meetings, Ms. Jeffers, would you come forward? And may I have a little guidance from the folks running the CAC committee? Fair enough, I understood the three options. Perhaps Mr. Hoshite is chairman of that committee. Any idea of when the follow-up, and as been stated by two speakers, there is urgency, especially in the contact and tracing, standing up that facility, that call center. I know that that's one of the things Ms. Jeffers is anxious to move forward. Would you want to give a timeline, or is that possible?
Sure, I'd be glad to. And again, our committee was formulated, I think approved within the last 2 weeks. We met a week ago, yesterday, for our first meeting. We had our second meeting yesterday, and I think we've been very productive in those meetings, creating the framework to provide these funds to be allocated. Our committee will be moving forward with another meeting Monday at 8:30 in the morning. The committee is committed to work weekly and even more than weekly if we have to, with the goal of having a significant portion of the work done before the end of the month if possible. So if we go forward, there's two allocations that the county would be in control of. One is an allocation under the local government section for unincorporated areas. That's already been allocated to or designated to Mr. Martin's committee, the Development Committee, for consideration. And then our group as a whole, or maybe we'll set up a special meeting of the board as a whole to have all the presentations made from the county side so that we can hear them all at once and prioritize. So I would expect that process. We're still getting information. Mr. Onzik's information came minutes before our meeting yesterday. Obviously, this is a fluid situation. We would expect that within the next couple of weeks, we'll have a meeting at which we'll discuss all the county requests.
Okay, thank you, Mr. Hoshite. Ms. Jeffers?
Good morning, Chairman and County Board Commissioners. We're here today because there's a public health pandemic. And that's what the CARES Act was afforded, because this country recognized we did not have the resources or the capacity to deal with a pandemic that has been within our country as well as the world. We have not seen a pandemic for 100 years. When we started, this board passed an emergency declaration on March 24th, giving me the authority to move forward. To wait would have put us at a dire strait in terms of addressing those individuals who first started out being positive, not realizing or recognizing the impact, the significance of what would happen to our community. We began to act. So we began to work and engage in the community, from things such as the many skilled nursing homes that we have that have outbreaks. Let's not forget, we have 60+ employees. The burden became so overwhelming. We work 7 days a week. I had to reach out. We have over 60 medical reserve volunteers. Remember, they're volunteers, so they come and go when they can. I have enlisted the help of the courts. The chief judge has been gracious in allowing us to use some of their staff when they had downtime, as well as development and other departments. So to manage this was overwhelming for our employees, and we continue to be overwhelmed by 8,000 cases plus. The importance of, it's not just contact tracing, it is mitigation, where it's really about enforcing the use of PPEs, the use of good hand washing, social distancing, and that takes the understanding of the guidance and the rules that we have been constantly learning, getting out, making posters. We have to make our own posters because we did not have funding to do so with a reputable company. So we've done all of this in-house with the print shop. We have not been able to make any public service announcements or get things out on a larger scale. This scale of work is unbelievable, and we've been doing it within our confines, and some of the expenses we had relied on the CARES Act funding. Containment is another activity that must go on. It's not just contact tracing. It's the sheltering in place, getting those homeless people, not just the homeless people that you think in a traditional sense. We have a whole new set of homeless people because they have lost their homes due to losing their jobs. They are living in their cars. They're still leaving and walking out in the street. So that population has to be addressed. The capacity of the mental health that is going on as a result of this has been outstanding. And trying to get services and getting people connected is not a part of our containment activities. We have to go into the nursing homes and work with them on their infection control plans. When nursing homes don't have good infection control plans, you've read not just in our community, but across the country, where outbreaks are happening and lives are lost. These are people. These are not numbers. These are people. You all are aware of the one plant we had to close because of the significant number of people who became infected. And then we had 3 deaths. All of that takes around the clock work, working with the community, working with the state's attorney, working with the Attorney General's office, as well as going up against the lawyers from those various food producing plants. And the last, we have to also engage in control. We control by reducing the number of positives that are tested, getting our community tested. People are under a lot of false assumptions that if I am not symptomatic, I am not contagious. The virus is shedding on you quicker than somebody who is positive. Just because you have no symptoms does not mean that you are not doing a viral shed. And as we all know, that can spread quite rapidly in families and offices. And then when we have that occurring, that puts a tremendous burden on our hospitals. If our hospitals get at surge capacities, we have people today that won't go to the hospital for fear of running into somebody with COVID. So the hospitals are having more and more seriously ill people entering their hospitals. People who could have been addressed earlier on might have mild heart attacks. Now they're full blown because of the fear. If our hospitals are overrun with COVID, it will be very difficult for them to address other healthcare needs. And so that's part of our work as well. That's part of the control. So the funding that we are requesting is not just about contact tracing. It is about mitigation, containment, and control. We have not stopped working on this. With 66 people, the state requires 30 people per 100,000. That means the health department would have to hire 160 additional people. We don't have capacity to reach out and do the onboarding and get all the technology that's required. So that's why it's important that we hire a company to assist us. And the company that we selected that I sent all of you, one of my requirements was they had to hire locally. This impacts our economy as well. We need our economy back to work as well. Also, we have a huge Spanish-speaking population, and we required them to hire people who are Spanish-speaking. There's a tremendous amount of training that needs to go on for those individuals. In addition to, one of the biggest things that we lack that the funding will help us is with marketing. There's so much misinformation about, how long do you stay home? Who's affected, who's not, who should be isolated, who should be quarantined. So the funding is not just about contact tracing. The funding is about mitigation. And let me remind you, those who were at CAC, we got a directive from the Illinois Department of Public Health. Each local health department is required to do a stockpile of 30 days of PPEs, not for distribution, but they're all waiting on the surge. As we watch the movement from all those southern states across from east to west, they know our hospitals and our communities will be overrun. So now we have to prepare 30 days of PPEs in addition to continuously supplying our first responders, our hospitals, our healthcare workers with regular burn rates of PPEs. So if we wait, then we're in line to probably missing that deadline. Our deadline is the fall to have 30 days of PPE storage for waiting for that surge. So when you ask me, this is about the public health response, not today, but today from March through December. We have to build capacity in our contact tracing. That does not occur overnight. We have to train folks. We have to develop protocols and procedures. You all have been in some capacity working with employees, and you know that's very challenging. When you onboard people, then people aren't going to stay because you're not going to always find the perfect person every time you go out. And then the whole goal of this is 24-hour turnaround, because one person, if you don't catch me in 24 hours, I could have the potential in a week of infecting 29 people, and then those 29 people multiply them by 29 people. So this is such a enormous task for any health department. Even if we had capacity of twice what we had, it still would be an enormous task for us to engage in. We have to work on expanding our testing site. We really only have one. I know Dr. Iqbal has called me several times, want one in the north, but currently we don't have capacity for that. And then we have to coordinate with all of our partners, not just our hospitals and our healthcare, but our schools. Our schools depend on us also for that information and guidance. So our efforts are not just for contact tracing, but this is a public health pandemic. CARES money was put out because of a public health pandemic, knowing that there's not one health department in this country that was capable of hiring, because as you know, we all put in our budgets, none of this was budgeted. And we are currently expending our budget on this event, and we'll eventually run into a deficit if we don't get the support from the CARES Act. Thank you for the opportunity to share with you the magnitude of this project and the urgency in which we need to move forward.
Okay, thanks. Thank you, Ms. Jeffers. I believe that Ms. Thomas would like to speak next, and then we'll go to Mr. Fraz. Ms. Thomas.
Thank you, Mr. Chairman. I move the previous question on resolution 20-240.
Okay, there's a motion to move the previous question. Is there a second? So moved by Mr. Hanson, or second by Mr. Hanson. Clerk, call the roll.
No, it's moved. Question. No.
A motion to call the question.
240.
This is on 240.
Call the question. Alan?
No. Alan, no.
All right. Guerrero?
Guerrero, yes.
Davis?
Davis, yes.
Raz?
Fresno.
Hanson? Hernandez?
Yes.
Oshite?
Yes.
Iqbal?
No.
Kenyon?
Yes.
Caius?
Caius, yes.
Opie?
No.
Leonard?
Could I have explanation on what we are voting on right here? I don't totally understand it.
Mr. McMahon.
My understanding is that this is a motion to vote on 240.
No, actually, it's a motion was made by Ms. Thomas to call the question, which would end the debate, seconded by Mr. Hanson.
No, Mr. Chairman, it was to end debate and vote on 240. That's the question before us, 240.
Okay, so, Mr. McMahon, can a person call to end debate, then have it just end the debate? There are other people who wish to speak.
Yes, so a motion can be made to end debate. Yes, if that was the motion, then that needs to be clarified.
Okay.
And my recommendation is that we start the vote over now that the motion has been clarified. If the motion is to end debate, that's what you're voting on. And if that motion to end debate succeeds,
good,
then you would move to the substantive motion.
Good. That's as I understood it. So
No, excuse me. I said I moved to the previous question on resolution 20-240, which means end debate and vote on 240.
It's the same thing.
There are some people who disagree with, you can make that motion, you can get a second, but not everyone agrees with ending the debate at this point as preliminary voting indicated. So would you want to withdraw your motion, or would you like to continue and have a vote on your motion, Mr. Hansen's second, to end the debate? And if that's successful, then we would go to vote on the substance of 20-240. So Ms. Thomas, what would you like to do?
Is there a friendly amendment from someone who wants to further discuss? I mean,
It's your motion. Would you like to continue with a vote on your motion? And Mr.
yeah, yes, I
Hansen?
would. I would like to continue with the vote.
Okay. All right. I think that the suggestion from Mr. McMahon is constructive, and so we'll start with that clarification, start the roll call fresh.
Mr. Chairman, would you please repeat what it is we're voting on?
Yes. We are now voting on a motion and a second to call the question, which ends the debate. So what we're voting on now is to end debate on this question. If it fails, we continue. If it succeeds, we take a vote on the substance. Okay, Mr.
No,
Kite?
Mr. Chairman, that was not my motion. My motion was to end debate and approve resolution 20-240.
You have two. I'll ask Mr. McMahon to sort that out then.
So the motion to end debate is a separate motion. My understanding is that that was the motion that was made. It was seconded. If my understanding is incorrect, or that's not the motion that was intended, then I think the chairman has invited you to either withdraw the motion or amend the motion. So there would be a vote now to end debate. If that succeeds, then you would move directly into voting on resolution 20-240.
Okay, if we can't do both, end debate and vote, then I'll withdraw.
Okay, Mr. Hansen, do you withdraw? Withdraw. Okay. Okay, so we're back to where we began. I believe that the next person was Mr. Frost who would like to speak. Mr. Frost.
Thank you, Mr. Chairman. One of our goals for today's meeting was to send forward some decisive action on things of an emergency basis. That said, I'm reluctant to take 20% of the county's funds and allocate them today. And I do appreciate Ms. Jeffers' presentation and the predicament her and her staff are in. In my opinion, if I understand it correctly, 5.6 million of that is contact tracing. If we were to approve 8 million of their roughly $13 million ask today, that would cover the contact tracing and give Ms. Jeffers of $2.4 million in additional emergency funding to get her through the next 30 days. And that would give the CAC committee time to review the balance of that, which would be an additional 5 million that we could send her way, but that would give it an additional review of that last 5 million.
Okay, so is the, Mr. Frost, is that a motion?
I guess I would not like to make a motion yet. I'd be happy to do it in the future, but if there's anybody else who wants to speak first, I'd be happy to listen.
Mr. Surgis, would you rise, please?
Drew, would that be, would those funds be considered out of the 55% portion?
Yes.
Clarity?
Correct.
I would be in support of that motion.
Okay, I believe Mr. Shefflow.
I have a question for Ms. Jeffers, I guess, along those same lines. My approach to this would be to allocate half of this money now, and half of the money would be considered at the next board meeting, because then we will have a bigger picture. If you got half of this funding, would you be able to enter into these contracts, get the contract tracers up and running? I mean, in other words, they're not asking for 5.9 million up front, right? They're asking some sort of a contractual term that I would assume they're going to have upfront costs that need to be covered. But would a partial funding get you where you need to go for 30 days?
So to answer your question, if I cannot have the entire funding, I would prefer to go with Commissioner Froz's because half doesn't do it. This is not a piecemeal, right? This is a continuation. Mitigation, containment, control is not contact tracing is just part of it. When you contact trace, there are activities that go with that where you have to contact people and provide them resources. And let's not forget, I have to still look for vendors to secure the resources that we need, be it the 30-day supply of PPEs. So again, the urgency of this, we all know we're all competing in this country for resources, and it will take time. As all of you knew, people were scrambling for masks just 3 months ago.
Thank you. Thank you, Ms. Jeffers. So it answers the question that if not all, then the portion that the board desires is certainly better than the zero. So I think I saw Mr. Surgis' hand go up first, then Mr. Leonard. Mr. Surgis.
I don't know how she could enter into a contract without knowing, are we going to get the balance of the money? But Barb, I heard several other things on your list, including a 30-day supply that under 2013 was voted down. That doesn't get you any money to get that on your shelf. So again, I would be in support of Drew's motion on this.
Okay, Mr. Leonard.
Thank you, Mr. Chairman. I too agree with Drew's amendment to the motion if he wants to move that, as long as Director Jeffers is comfortable with that $8 million amount. I think it's important, once again, through all the action we take today, that we move forward and get things going and not delay things. So I'm in support of Mr. Froz's recommendation on that if he makes the amendment. And I hope the board as a whole will realize the need and the emergency of this $8 million that Mr. Froz had talked about.
All right. Thank you, Mr. Leonard. Is there any other discussion before we go to Mr. Froz's motion, Mr. Leonard's second? Mr. Copey.
Thank you, Mr. Chairman. My laser focus is going to be on the contractor, Ms. Jeffers, and has the CAC committee been, had they invited this contractor to give their presentation? And also, and even if they didn't, the concern is that we have no fundamental control of what we're getting for our money. It's whatever the number was. It turns out to be, if you do the math, it's about $35,000 per 160 people as a salary. But how many people will they actually employ? Is there a guarantee that they will employ? How many hours will they be employed? All these questions are fundamental to the outcome. And if we're just paying this huge fee to a contractor we've never met, I'd have to question the plausibility of that action. So I guess that's all I have to say.
Okay, thank you, Mr. Copey. I believe that you have a response, Mr. Hoshite.
Yes, Mr. Copey, we have not vetted any vendor to provide the services. In fact, if we approve this motion, whether it's amended or not, we're not approving any specific vendor. The health director would still have to go through the procurement process, and it would be in that process, a determination would be made who's appropriate to do the work. The $8 million to me seems like a lot of money for it, but I have respect for Director Jeffers that she didn't just pull those numbers out of the air, but we'll have to have justification for it. And that'll be a separate vote once we allocate the resources.
And any other big items? And then we'll go to, because there's going to be amendment, and then we'll come back to, if that's successful, to be discussing it some more. Mr. Hanson.
Thank you. And thank you, Barb, for the containment summary you sent out on Friday. A lot of the questions being asked now, probably in that summary. I'm having a tough time getting my hands around contact tracing in the big picture. What happens beyond 2021? Is this going to continue to be a county-led initiative? Is there going to be an intersection with a state-run program? And I'm in full support of everything in front of me today. And we know that some things are time-bound, but certainly a DuPage County, a Lake County, McHenry County is going to be in the same type of program. Is the state going to take this over at some point? And just like we talk about all of our grants, when the money runs out, then what? Do you see it? Do you see aid from the state or from the federal level coming if it continues to be a county-led initiative?
We anticipate getting funding from the state, and that will carry us from January through May. And all health departments will be in the same position if they get the funding. But we've been told we will be getting funding because they want us to run this through May.
Okay, thank you. Does
that
that answer the question?
Yes, that's one of my primary questions. The other one is regarding the commodities. That is a big piece up there, and I understand that you're required to make sure that our county has a 30-day supply of PPE. Is that price tag there? Is that for you to build up our 30-day supply?
No, that's plus 30-day supply. That's more than PPEs. That's our mitigation for our homeless. That's our mitigation for our long-term care facilities. That's our mitigation for our food plants. So it's not just.
I see it broken down there, but I don't know if that was if that 1.1 is our 30-day buildup.
No.
Okay. So there's an additional cost to that.
Because we have to continuously supply our community with PPEs, our first responders. So that's that piece of it plus the 30-day.
Okay. Thank you.
Okay. Thank you, Mr. Hanson. Okay. Mr. Sanchez.
Thank you, Mr. Chairman. I definitely understand the hesitance to approve such a large price tag. I had the same hesitations last week. I didn't want to leave all my questions for this meeting, so I reached out to Director Jeffers over the weekend, and she was gracious enough to take my call. We spoke for about an hour. I got to ask all the questions I had, and she explained a lot of the context for what went into this proposal. It wasn't put together at last minute. There's a lot of thought into this, a lot of planning, and a lot of consideration for the appropriate types of response that we need now and that we're more than likely going to need in the fall, assuming there will be some sort of second wave that at least everyone agrees is likely to happen. So I am in favor of this as a member of the CAT committee. I am very hesitant to approve anything that hasn't been vetted through our process and our plan, and we haven't figured that all out yet. This is an exception to that rule in my mind. I don't expect everyone else to agree with that, but this is the main reason we have CARES Act money. Based on my conversation with Director Jeffers, I don't see that we will have any substantive changes or corrections or changes to make to this proposal, despite the large price tag. I think it is priority of our spending, and I'm in favor of it going forward as it is.
Okay. Thank you, Mr. Sanchez. Any other thoughts from anybody before I go to Mr. Fraz? Anybody on the, Ms. Wonicky?
Thank you, Mr. Chairman. I just want to say that I've been attending the CAT committee I think they're moving forward very quickly and in a very good fashion. And should Mr. Fraz make that motion, I will vote on that motion. I
Okay,
will
thank
vote
you, Ms.
yes.
Wodnicki. Ms. Thomas.
Thank you,
have
Mr.
the-
Chairman. Thank you, Mr. Chairman. I'd just like to echo what Mr. Sanchez just said. I have been the one asking to see the complete picture and stressing the need for us to take everything into consideration before making a decision about how funds are spent. But the health department is the exception. Unless we can keep numbers down, implement contact tracing, and keep the spread under control, nothing else matters. We can open up, but if there are spikes, we will close down. We can open up schools, but if there are breakouts, schools will close down. Parents will have to modify work schedules again. So I'm just imploring my colleagues to, are we, am I totally comfortable, again, making the expenditure without seeing all of our need? No, but the health department is the exception. We all know Director Jeffers' standard with respect to, operating with excellence, reliability, dedication. And so she has outlined the need, and I think we are obligated to follow through today. Thank you.
Okay, thank you, Ms. Thomas. Any other thoughts before we go to the amendment? Seeing none, hearing none, Mr. Fraz, would you make your
Yeah, actually, I'm going to change it slightly. Mr. Weber pointed out that on Ms. Jeffers' breakdown, 3 of the urgent items, contact tracing at 5.6, containment at 2.3, and mitigation at 440,000, come up to 8.34 million. So I will make a motion to amend the resolution to change the 12.9 million to 8.34 million, with the CAC committee to review the balance as quickly as possible over the next 30 days.
Okay, so moved by Mr. Fraz, second by Mr. Leonard. Discussion on the amendment.
I would ask that I would ask that it be amended to include that it comes from the 55%.
That's implicit, that's your intention?
Agreed.
Right, okay, so that's clarification on the amendment. Any other thoughts or comments? Seeing none. Anybody on the phone? Hearing none. Clerk will call the roll on the amendment to number 2240. That's the 8.34 million for the uses specified by Mr. Fraz. Clerk, call the roll.
Ellen? Ellen, are you there? Okay. Barrero?
Barrero, yes.
Davis?
Davis, yes.
Raz?
Yes.
Hanson?
Yes.
Hernandez?
Yes.
Hoshite?
Yes.
Iqbal? Kenyon? Caius?
Caius, yes.
Copey? Copey?
No.
Leonard?
Yes.
Lewis?
Yes.
Martin?
Yes.
Molina?
Molina, yes.
Sanchez?
No.
Chuflo?
Yes.
Silva?
Silva, no.
Starrett?
Starrett, no.
Surgis?
Yes.
Thomas?
No.
Weber?
Yes.
Wegman?
Yes.
Winicky? Yes. Ellen, did you return for a vote? Okay, still passes.
Okay, motion passes. So 240 is now amended. Is there any further discussion or on 240 as amended? Let's see, Mr. Rickman, I don't need a fresh motion in a second on 240 as amended, correct?
I don't
It was
either. I don't either.
Sanchez and Leonard. So I should, actually, I'm going, I think so too. May I have a motion and a second to pass 2240 as amended? And the people at first on that are Sanchez and Leonard. Would you like to, you have first call?
I agree.
Okay, and so, okay, so we have a motion and a second, 240 as amended. Any discussion? Seeing none on the floor, anyone on the phone? Hearing none, clerk call the roll on 2240 as amended.
Okay, Ellen. Rero,
Yes.
Davis,
Davis, yes.
excuse me, Fraz,
Yes.
Hanson,
Yes.
Hiller, I'm sorry, Hernandez,
Yes.
Hoshite,
Yes.
Iqbal,
Yes.
Kenyon,
Yes.
Caius,
Caius, yes.
Opie,
No.
Leonard,
Yes.
Lewis,
Yes.
Martin,
Yes.
no,
Molina, yes.
Sanchez,
Yes.
Chuflo,
Yes.
Silva,
Silva, yes.
Sarah,
Starrett, yes.
Burgess, Thomas,
Yes.
Weber,
Yes.
Wegman,
Yes.
Winnicki. Passes.
Okay, the motion passes. Now may I have a motion and a second to discuss and potentially pass number 2241? So moved by Mr. Hoshite, second by Mr. Surgis. Mr. Hoshite.
Thank you, Mr. Chairman. Circulated before the meeting today was the resolution that we're considering now. The CAC committee met and agreed with respect to the urgency for distributions on two basic concepts. One was that we would allocate the amount of the CAC money on a pro rata basis, 55% to the county and 45% to local government entities. And second, that having approved that allocation, we would make 80% of the 45% allocation available for immediate distribution, subject to the entities complying with the requirements that we would establish. And then the other 20% would be dealt with later on as we finalize census numbers and iron out the rest of the issues that the committee's considering. With respect to the application itself, there was an application and an intergovernmental agreement that were presented at the committee yesterday. Everyone has been tasked with homework to review that, with the hope that we will approve that at the committee level next Monday at our meeting. And so the resolution that was presented today contains two items in it, the 45-55 split that I mentioned, and the availability for disbursement of the additional, of 80% of that amount money right now. I would like to move to amend the motion to include one other concept or the resolution. And I have specific language that I'll read, but I want to just talk in general concepts. The goal was not only to approve the framework for the allocation of the funds, but also to allow the funds to be immediately accessed as long as the municipalities and the local government entities that applied met the criteria that we approved. So I'd like to add this language in an amendment to the resolution that's been presented. And it would read, upon submission from a local government entity, which is accompanied by an application and intergovernmental agreement in a form approved by the Kane County State's Attorney, the Kane County's treasurer is authorized to disperse the funds approved by the Kane County State's Attorney immediately. And so that's my motion. I move to amend the resolution that's in front of us with that additional language being inserted. And I can provide the specific wording to the clerk should this prevail.
Second.
Okay, so moved by, let's see. So amendment to, a motion to amend to 2241 and seconded by Mr. First of all, moved by Mr. Hoshite, second by Mr. Fraz. Do I assume, just for clarification, do I assume correctly that application includes the proper documentation?
That's correct. The application and an accompanying intergovernmental agreement, correct.
Okay, and so that wording you've read into the record, I'm sure that you'll supply it and then I guess at some point, everybody on the board will get that actual language. Is that right, Mr. Fraz? Is that your understanding
Yes,
also?
it is.
Yes, okay. Okay, so we have a motion and a second. Any discussion on that amendment? Dr. Iqbal.
Yeah, Mr. Chairman, I agree with the amendment. I don't know where it goes right in the resolution. At the same time, I sent a similar amendment to this resolution. I think the very last wording on this resolution, which is we said now therefore be it resolved that those funds allocated to municipalities and unit of local government, 80% of that amount shall be available for distribution. It says as soon as practicable. And I would like to amend as soon as practicable to if deemed legally permissible. But it says the same thing Mr. Hoshait is saying. If we can cross this language, so there's no contradiction.
Okay, it's okay. I understand. Dr. Iqbal.
Mr. Chairman, I'd be willing to amend my motion to amend to eliminate the words as soon as practicable, ending that phrase with a period, because if my amendment with the additional language is approved, that would require the application and documentation and intergovernmental agreement as a condition precedent to disbursement.
Is that acceptable?
Yeah, that's what my intent is. Thank you.
That makes sense. Okay, Mr. Fraz.
Sorry, don't.
You agree to amendment?
I agree with that. I just want a little clarification, or maybe just to make sure we're doing things right. Mr. McMahon or Mr. Hoshait, our auditor has to account for every penny of this. Will he still have an opportunity in that sequence to do his job?
Yeah, good point, Mr. Fraz, and also our treasurer has a say in that because he presented at our committee meeting that we do pay our payments payables twice a month. And if we're going to expedite this, he would have to do a special payables. So sure, the coordination between the state's attorney's office, the treasurer, the finance department, and the auditor will all be understood as part of the process.
That's absolutely right. I had a brief meeting with the treasurer and the auditor yesterday. I have a follow-up meeting scheduled with the director of finance, the auditor, the treasurer, and some other folks within the county. The intent is to move the review and the payment of these kind of claims, for lack of a better word, through the normal payment process. So that it would go through the auditor's office before it gets to the treasurer, who actually cuts the check and sends that out.
Okay, thank you.
Okay, and perhaps in a subsequent resolution from CAC committee that comes to the full board, that sensible clarification can be made in the actual language. I mean, it's probably implicit, but why not make it clear? So we'll look for that in the future. Okay, so we have a motion and a second, and it's been clarified. And Mr. Scheffler.
Just had a
Could
question.
someone mute their phone? We're getting feedback.
So when this application comes in, the municipality is going to submit a description of how that money is being spent. And then the state's attorney's office is going to review that and give an opinion or determine that it's compliant with the CARES Act. Those are two questions, I guess. The third being, and then does this become public? Will it be posted somewhere on our website? Because that's the transparency that I think we all talked about.
Mr. Chairman, may I respond?
Excuse me, Mr. Hoshai.
Yes, I think one of the things, Mr. Scheffler, is evolving right now is the application itself and the intergovernmental agreement. I think those questions will be answered. To the extent that level of detail is not contained in the current application, we'll make sure it is as we approve that hopefully at our next meeting. Regarding any application that's submitted, that's subject to being FOIA'd, so it'll be part of the public record. I think that as a matter of convenience or at least disclosure, we can make a special publication if you want, or database available to see what applications have been made so that we know where we're at. And then we had suggested as a committee yesterday unanimously that the state's attorney's office would be the clearinghouse for applications. I keep coming up with a term for that, but they've graciously indicating a willingness to do that. And part of that process will include accepting the applications, making sure all the details there, and reviewing them internally. However, legally, it's not, deemed by the state's attorney to be appropriate.
Okay, other discussion?
Mr.
Seeing
Chairman.
none,
Mr. Chairman.
Mr. Copey, I believe you have your hand up.
Chairman Hochschild, when will we be able to, Chairman Hochschild, when will we be able to see some type of a semblance of an allotment schedule? I understand the application processes may develop some different numbers, but there are entities that have submitted their requests, and what I thought was fair originally on the task force resolution has been eliminated completely. Can we get any kind of an idea of where our municipalities are going?
Okay, Mr. Hochschild?
I think the framework that the task force set up is pretty much intact, with the exception of the exact census numbers. Per the issues raised by Mark Armstrong about census numbers, it was suggested that we go back, look at the most recent CMAP figures. We received those, have reviewed those. I'd say most 90+% of the municipalities are on board. We've set up a system between hopefully now and Monday for the municipalities that have questions on the census figures to meet with representatives of the state's attorney's office to try to clarify, with the hope that we'll have a final census number agreed to at our committee next month, or next Monday. So the anticipation is there. At the same time, we'll have our application approved, hopefully, and within the application, there will be a certification by the applicant as to their census figure. So I don't think the framework's changed dramatically from the task force. I think their framework was good. It's with the consent of the local governmental entities. We're simply fine tuning to eliminate the question on census numbers.
Okay, other discussion?
Mr. Chairman.
Ms. Allen, you
Thank
have the
you.
floor.
I just wanted to clarify that when a unit of government overlaps, for instance, a fire district has in its territory a municipality and unincorporated land, that the municipality would be directed to pay its share of those expenses, and the unincorporated monies would go towards the rest of those expenses. Is that implied in the resolution?
Okay, thank you, Ms. Allen, for that clarification. For legislative intent, basically, Mr. Hochschild, is that the intention of the?
It is the intention. The fire districts did raise a legitimate concern. The commitment is to do this fairly. We're encouraging the municipalities to include in their requests the fire district that is covered by the municipality, to the extent that there's areas of that fire district that are in the unincorporated area. They will present their figures to Mr. Martin's committee to deal with the unincorporated allocation. We're working with GIS to develop population figures to make sure that's exact. In the event a municipality, for some reason, intentionally or otherwise, doesn't include their fire district in their application. We will talk to them to make sure that they comply, but it's my understanding in discussing with the group of municipalities that they're all on board with that procedure.
Okay, thank you, Mr. Hoshait. Other discussion? Dr. Iqbal.
Mr. Chairman, I just wanted to alert or caution the committee that before the county got the money, it certified the population. That number is fixed. So how it is divvied up is the only question. So I just want to alert them that that number cannot change.
That is certainly true. So thank you for elucidating that once again. But that's the county population in total is fixed.
It's fixed, and also I may say that it's based on 2019 vintage
right
population something.
Right, that's what I signed my name to. So good. I think I saw somebody's hand go up, but no, I'm seeing things now. Okay, anybody on the phone? Any further discussion?
Mr. Chairman, I raised my hand in chat.
Thank you, Ms. Thomas. You have the floor.
A technical question about the 80% distribution. This resolution doesn't address the 20%. Do we need to say an initial distribution of 80% or not? And do we have to come back with a second resolution to allocate the remaining 20 possibly?
Okay, Mr. Hoshait, what would be the CAC's intention?
Ian? The committee's intention with the 80% was to provide that 80% would be available for immediate distribution as long as all the criteria were satisfied. I think we would be coming back with another resolution down the road with the balance of the funds as we bring other resolutions forward as we work our way through this process. So I don't think that needs to be addressed today.
Okay, thank you.
Okay, further discussion? Seeing none. Any on the phone? Hearing none. Clerk, call the roll.
On the amendment, right?
This is on the amendment.
On the amendment.
Can we repeat the amendment, please?
Let's see. So, Mr. Hoshait.
I'll do my best. There were two parts of the amendment. The first was in the now therefore paragraph on page 2. In the second line, a period was inserted after the word distribution, and the balance of the sentence was eliminated. The second part of the amendment added another paragraph that stated, upon submission of a, or I'm sorry, let me start again. Upon submission from a local governmental entity, which is accompanied with an application with supporting documentation and an intergovernmental agreement in a form approved by the Kane County State's Attorney, the Kane County Treasurer is authorized to disperse the funds approved by the Kane County State's Attorney immediately.
Was there any role in what you just said? I did not hear the auditor. Chief Financial Officer, I understand that would be on internal grants, but how about, did you want to include anything on the auditor?
No, yeah.
I think what we've established is the criteria, the auditor's involvement. In fact, certainly, I think the state's attorney has a good working relationship with the auditor. The auditor input is appropriate, but he's even mentioned at our committee meetings, being further involved could create a conflict of interest for him. So I don't want to.
That's why I asked the question.
I don't want to hang him up on that issue, but certainly to the extent, and I would expect that his recommendations in review of our application and intergovernmental agreement his comments on that will be forthcoming, so they're incorporated into our final document.
All right. And then do you want any language in there about that this is part of the public record for full transparency? Just for a reassurance to.
I don't think that's necessary for the resolution, but as chairman of the committee, I'll direct the state's attorney's office to cooperate with us to provide that information.
Okay, all right. Mr. Shefflo.
Am I correct that the point of your amendment is based on the treasurer's comments, who said in the ordinary course, it takes about 30 days to get a payment made, but he's going to now process the payment immediately, or specially and separately as soon as possible, as opposed to the ordinary course?
In part, yes.
Okay. Other questions or comments? Seeing none, hearing none, clerk will call the roll on the amendment.
Allen,
Allen, aye.
Ferrero,
Ferrero, yes.
Davis,
Davis, yes.
Raz,
Yes.
Hanson,
Yes.
Hernandez,
Yes.
Hoshait,
Yes.
Iqbal,
Yes.
Kenyon,
Yes.
Caius,
Caius, yes.
Copey,
Yes.
Leonard,
Yes.
Lewis,
Yes.
Martin,
Yes.
Molina,
Molina, yes.
Sanchez,
Yes.
Shefflo,
Yes.
Silva,
Silva, yes.
Barrett,
Garrett, yes.
Burgess,
Yes.
Thomas,
Yes.
Weber,
Yes.
Wegman,
Yes.
Winnicke. That passes.
Okay, the the amendment passes. Now the resolution 20-241 as amended. Is there any further discussion? Seeing none on the floor, any from participants on the phone? Hearing none, clerk will call the roll on 241 as amended.
Allen,
Allen, aye.
Ferrero,
Ferrero, yes.
Davis,
Davis, yes.
Raz,
Yes.
Hanson,
Yes.
Hernandez,
Yes.
Hoshait,
Yes.
Iqbal,
Yes.
Kenyon,
Yes.
Caius,
Caius, yes.
Copey,
Yes.
Leonard,
Yes.
Lewis, Martin,
Yes.
Molina,
Molina, yes.
Sanchez,
Yes.
Shefflo, Silva,
Silva, yes.
Starrett,
Garrett, yes.
Burgess,
Yes.
Thomas,
Yes.
Weber,
Yes.
Wegman,
Yes.
Winnicke.
Yes.
Passes.
Okay, the resolution as amended passes. Let's go to resolution that's on the agenda, I believe at 8D. It's the collective bargaining agreement for the sheriff's deputies and sergeants. Let's see what the will of the board is on that. May I have a motion and a second to discuss and potentially approve that? This has been negotiated consistent with the instruction from the Labor Management Committee. Very important to get this moved forward in the sheriff's area and his staff. So moved by Mr. Leonard, second by Mr. Hanson. Discussion. Seeing none on the floor, is there any on the phone from participants? Hearing none, clerk call the roll.
This, just for clarification, this is resolution 20-244.
That's correct.
Allen,
Allen, aye.
Ferrero,
Ferrero, yes.
Davis,
Davis, yes.
Raz, Hanson,
Yes.
Hernandez,
Yes.
Hoshait,
Yes.
Iqbal,
Yes.
Kenyon,
Yes.
Caius,
Caius, yes.
Copey,
Yes.
Leonard,
Yes.
Lewis,
Yes.
Martin,
Yes.
Molina,
Yes.
Sanchez,
Yes.
Shefflo,
Yes.
Silva,
Silva, yes.
Starrett,
Starrett, yes.
Burgess,
Yes.
Thomas,
Yes.
Weber,
Yes.
Wegman,
Yes.
Winnicke.
Yes.
That passes.
That motion passes. Appointments, may I have a motion and a second to approve the appointment, reappointment of Richard Hurst of the Lake Marion River Conservancy District. Motion is made by Mr.
Caius.
Sanchez, second by
Caius,
Mr. Caius. Any discussion?
Mr. Chairman?
Seeing none on the floor, but on the phone, Mr. Caius?
Yes, just on my copy here, it says Lake Merriam ends with an M. It's a clerical thing. Make Lake Merriam River Conservancy. It should be
Thank you,
Marian.
thank you very much, Mr. Caius. We understand. It's a scrivener's error.
Yes, thank you.
Thank you so much for pointing that out. Any further discussion? Hearing none, seeing none, clerk call the roll.
Ellen for the appointment.
Allen, aye.
Ferrero,
Ferrero, yes.
Davis,
Davis, yes.
Fraz,
Yes.
Hanson,
Yes.
Hernandez,
Yes.
Olshake,
Yes.
Iqbal,
Yes.
Kenyon,
Yes.
Caius,
Caius, yes.
Opie,
Yes.
Leonard,
Yes.
Lewis, Martin, Molina,
Molina, yes.
Sanchez,
Yes.
Shefflo,
Yes.
Silva,
Silva, yes.
Starrett,
Starrett, yes.
Sturgis,
Yes.
Thomas,
Yes.
Weber,
Yes.
Wegman,
Yes.
Winnicke.
Yes.
The motion passes. May I have a motion and a second to go into executive session? So moved by Mr. Weber, second by Mr. Shefflo. We'll take a voice vote on this one. All those in favor say aye.
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 All those opposed, nay. Ayes have it. Thank you very much for,
I just want to thank the board for their support today, for allowing us to move quickly and rapidly because there's a lot to do. So thank you so much.
thank you, Ms. Jeffers.
We got executive session. He's gonna. We have to leave, yeah. Sorry.
I'm sorry, I took a voice vote on that one. You know what? I want to please Mr. Shepro, always. So may I have, let's see, the motion was made by Weber. It was seconded by Shefflo. The clerk will call the roll to go into executive session. So
Ellen,
call the roll.
Sure.
Ellen to go in executive session. This is a formal roll call. Ferrero. Oh, this,
We've probably lost those people
I was
going
gonna
over
say.
to a secured line.
Davis,
Davis, yes.
Did it just switch us over?
Maybe, I don't know.
Yeah, are we supposed to hang up? They didn't say.
No, they're gonna vote. They need a roll call vote.
Right, but did they?
I think they put us in the room, the breakout room, even though I didn't hit join.
Oh, okay.
They cut us off somehow. They had to go back for roll call vote to go officially into the executive session. Voice vote wasn't enough. So I don't know how they're going to clarify it now.
But are we supposed to stay on the line?
I think you're supposed to go into the breakout room. If you get an invite, go into the breakout room.
Oh, okay. Here it is. Thank you.
could give us just 1 minute while we return back to the open session. I think we have everybody back in the open session now.
Okay, thank you on the phone. We'll give just two.
Welcome back.
Should be good.
Okay, now that we're back in open session, I'd like to, may I have a motion and a second to approve settlement of claim number 19 WC 011439. So moved by Dr. Iqbal, second by Mr. Shefflow. Any discussion? Mr. Copey?
Is it the 96,000?
No.
B.
439 is in the amount of, that may, yeah. So that's the 28,003. Any further discussion? Seeing none. Any participants on the phone? Hearing none. Clerk, call the roll.
Ellen,
Ellen, I.
Barrero,
Barrero, yes.
Davis,
Davis, yes.
Raz,
Yes.
Hanson,
Yes.
Hernandez. Hoshite is gone. Okay, Iqbal,
Yes.
Kenyon. Caius,
Caius, yes.
Opie,
Yes.
Leonard,
Yes.
Lewis,
Yes.
Martin,
Yes.
Molina,
Molina, yes.
Sanchez,
Yes.
Shefflow,
Yes.
Silva,
Silva, yes.
Starrett,
Starrett, yes.
Burgess,
Yes.
Thomas,
Yes.
Weber,
Yes.
Wegman,
Yes.
Winnicke.
Yes.
Passes.
Okay, the motion passes. And I believe that if you, Mr. Kenyon has left the meeting. So may I have a motion and a second to approve settlement of claim number 20 WC 001100. So it's resolution 20-243. So moved by Mr. Sanchez, second by Mr. Weber. Any discussion? Mr. Copey?
Is that,
This is the amount of 67.8. Okay, any further discussion? Seeing none, any participant on the phone? Hearing none, clerk call the roll.
Ellen,
Ellen, I.
Barrero,
Barrero, yes.
Davis,
Davis, yes.
Raz,
Yes.
Hanson,
Yes.
Hernandez. Hoshite's gone. Iqbal,
Yes.
Kenyon, Kenyon's gone. Caius,
Caius, yes.
Opie,
Yes.
Leonard,
Yes.
Lewis,
Yes.
Martin,
Yes.
Molina,
Molina, yes.
Sanchez,
Yes.
Shefflow,
Yes.
Silva,
Silva, yes.
Starrett,
Starrett, yes.
Burgess,
yes.
Thomas. Thomas,
Thomas, yes.
you, Weber,
Yes.
Wegman,
Yes.
Winnicke.
Yes.
That passes.
Okay, motion passes. May I have a motion and a second to approve settlement of claim number 17 WC 21778, which is resolution 20-214, and this is the 96,900 settlement. So moved by Dr. Iqbal, second by Mr. Shefflow. Discussion. Seeing none, hearing none on the phone, I'd like, on behalf of every taxpayer who talks back to the television or radio, when the news is on, or has lost confidence and trust in the government that they pay so much for, I'd like to just outline what you're going to be asked to vote on in the next moment. State's Attorney's Office recommends that you award nearly $97,000 payment to an employee who has grossly and shamefully negligent. A deputy was fully armed versus a prisoner who is naked. He's supposed to be cuffed to a bed, just had part of a sandal removed from his stomach that he had eaten. And yet this officer was overpowered and disarmed, and the gun was taken away. This led to the following consequences: 2 nurses being raped, a hospital and a whole community being terrorized, payment of millions and millions of dollars in damages, and the electoral replacement for a sheriff who is responsible for the actions of his staff members. But now some psychologist doctor says that the employee feels bad. State's Attorney's Office rolls over and wants you to pay $97,000. I would say, how about the 2 women and the whole community who suffered through this circumstance? This case proves that there is nothing that government won't waste taxpayer money on. This is part of the pattern where 47 insurance companies refused to even bid on our business because of our record on defending our interests. I can give you my commitment that I will not sign any document that has to do with awarding $97,000 to a person who did such a terrible job. Then there's that the argument is made that this is worker comp. And I would say that, do you really mean that a judge is not wise enough to discern the circumstances of what occurred here? Do you have so little confidence in the judgment of a judge who would make this decision? Or that a system has been so corrupted that they reward a person who produced all this damage? Well, of course, the psychologist, doctor who the employee hires is going to give an opinion that, well, he's feeling really bad about this. He should feel really bad about it. And so all you have to push back on behalf of 532,000 people is your vote. And you say, well, no, this is all the complicated lawyering and all that. But in the end, we're not lawyers at this moment. We are county board members representing 20 to 25,000 people apiece, and try to explain a yes vote on awarding $97,000 to a person who did this damage to so many people. That's all I have to say. Any further discussion? Mr. Sanchez.
Thank you, Mr. Chairman. I can't speak on behalf of my colleagues, but I would guess if I had to poll everyone, we would all find ourselves disgusted that we're being asked to vote on this. We're not lawyers. We don't understand all of the complicated contexts that go into these kinds of cases. And the ones we do have that are lawyers that are tasked with briefing us on those complicated contexts have informed us that this is the most prudent financial route to go. I'm disgusted to vote yes to this and award any money to this individual, but I would be even more disgusted to take this to trial and reward an even greater sum of money to this individual, which I think would be even more of a disrespect to the taxpayers of Kane County. Thank you.
Thank you, Mr. Sanchez, for speaking in favor of awarding $97,000 in this case. Mr. Copey.
On behalf of District 9, sue me.
Exactly. Okay, any other discussion?
Mr. Chairman, this is Ms. Thomas.
Yes, Ms. Thomas.
I am going to go a little further, building on what Mr. Sanchez said. We just heard from our colleagues, and a number of us were on the record disapproving of what we have to do today. And we're not lawyers, but we understand the law, and the law is clear. Illinois is a no-fault state, and we really have no choice here. And again, once again, this is a matter of having to cut our losses to avoid additional costs to taxpayers. And so while, and I'm going to presume that no one is comfortable approving this, voting for this today, but it is in our best interest, and it is the right business decision. Thank you.
Okay, thank you, Ms. Thomas. Ms. Thomas, in my absence of not signing my name to a reward of $97,000 for this much damage being done to our entire county, do you intend to sign this resolution as vice chairman?
I don't know, Mr. Chairman. That's not the question before us at this particular moment, but I will honestly say I don't know.
Okay. Any further discussion? Seeing none. Any from participant on the phone? Hearing none. Clerk, call the roll.
Allen,
Allen, no.
Barrero,
Barrero, yes.
Davist. Davist. Fraz,
Yes.
Hanson,
No.
Hernandez is gone, Hoshite's gone, Iqbal.
Yes.
Kane's not here, Caius,
Caius, yes.
Opie,
No.
Leonard,
Yes.
Lewis,
No.
Martin,
Yes.
Molina,
Molina, yes.
Sanchez,
Yes.
Shefflo,
Yes.
Silva,
Silva, yes.
Starrett,
Starrett, yes.
Burgess,
Yes.
Thomas. Thomas, are you there?
Yes.
Weber,
Yes.
Wegman,
Yes.
Winnicki,
Yes.
passes.
Okay, motion passes. Next item on the agenda is, may I have a motion and a second to adjourn? So moved by Dr. Iqbal, second by Ms. Winnicki. Clerk, call the roll.
Okay, Allen,
Allen, aye.
Barrero,
Barrero, yes.
Davist. To adjourn, Davist, Fraz,
Yes.
Hanson, Iqbal,
Yes.
Kenyon, oops, Kenyon's gone, Caius,
Caius, yes.
Opie, Leonard,
Yes.
Lewis, Martin,
Yes.
Sanchez,
Yes.
Molina, yes.
I'm sorry, sorry, Molina. All right, Shefflo, Silva,
Silva, yes.
Starrett,
Starrett, yes.
Burgess, Thomas. Must be gone, Weber,
Yes.
Wegman,
Yes.
Winnicki. That passes.
Thomas, yes.
Okay, thank you. 12:20.